Guys, it is about that time where here in the US, we unfortunately have to go through the painful process of choosing a health insurance provider for the next year. This is something I always dread. It happens in November and December every year.
Which is the worst time of year it could be, honestly.
Well, it's the only time of year it could be to go into the next
but I'm
year.
just saying, like, you're trying to enjoy the holidays, like Thanksgiving and Christmas, but instead you've got to worry about this.
We have to go through all the different plans we could choose from, and this year it is.
I mean, it's progressively gotten worse since
it's insane.
2008.
That's all we're going to go. That's all we're going to say here right now with it. It is insane. I think we actually might make a video at some point soon showing like
what you guys don't have to worry about.
Yeah. And so, guys, I came across this video and I thought this will be interesting. Who the world's experts? I don't know who these experts are, but supposed experts say has the best healthcare system. And on the thumbnail, it has numerous countries. It has numerous European countries, Canada, Australia, UK, Germany. I think France was on there. And I think
as
some
contenders.
Others. US. Now, I'm guessing the US is not going to win out. But I kind of want to see what they not only say about the U.S. healthcare system, but I want to see what's said about the U.K. and other nations as well. I think before we get started, I would like to say that the U.S., I can get good quality healthcare. That's not the problem. The problem is not lack of healthcare service and quality of healthcare. It is the fact that we have to go through this aggravating process of buying health insurance, and it's getting progressively more expensive, and the premium you pay doesn't even cover everything. You have to cover your deductibles and copays and whatnot. In a lot of cases before, like you can get anything for free.
Yeah.
Mind you, we get one thing for free. That's the annuals, the physicals. You get those for free, but most things you don't. So, guys, enough rambling. Let's go in here and check out what experts say about who has the world's best healthcare system.
I want to start with a simple question. Which country in the world has the best healthcare system?
Yeah.
A simple question.
I hate that question. Here's where you should ask me why I hate that question.
I knew you were going to start with that question.
I think it's a question that a lot of people ask. Which country has the best healthcare system? And
I don't think there's a correct answer to it.
It depends on what it is that we value.
I'll give you an answer, but then I'll tell you why the answer might not be applicable. If you look at the World Health Rankings, the country that came out on top is France.
Like the healthiest people?
I think in general, starting from France and working northern, you tend to get the best healthcare systems. But the reason why it's not...
Okay, so all of Europe, basically. What?
Okay, so he's saying France is technically the best.
Based off
and
of some
then going north
ranking.
in Europe is...
They're all good, something like that,
Entirely applicable is that what works in one country may not work in another country.
That's true.
So
I think a lot of it had to do with size to a certain extent. Some countries, depending on the size of their population, some things are going to work that wouldn't work in a larger population.
Right.
You know?
Yeah.
A number of years ago, just a few years ago, I wrote a piece in the New York Times with my colleague Aaron Carroll. We actually did a tournament of health systems. It was like a bracket tournament, the way March Madness is a bracket tournament, or like a tennis tournament. And we had me and Aaron, Uwe Reinhardt, Ashish Jha, physician, now Dean of Brown, and Craig Garthwaite, an economist at Northwestern. And we each voted in each of the brackets, like in each of the pairings.
Wait,
for which
whoa. The U.S. beat Singapore.
I'm surprised by that.
I'm surprised they're saying the U.S. beat anybody. Right? Like, really? I mean, like, you know,
anyone?
Considering the price of our healthcare, we know that the health care...
Well, I don't know that it's based on price.
Sure it is. It's based off of all sorts of factors. You know it is.
Well, some factors, but I'm just saying, like...
But maybe it's the quality of care here versus the price. The price is the thing here. That is the main thing.
Yeah.
So we got the UK beating Canada, Switzerland beating Germany, Switzerland beat the UK, and France beat the US.
And we liked better. And then like we ultimately got a winner. But one of the important takeaways from that whole process is that in no pairing did any country win 5-0. There were 5 of us, right? We were not unanimous in any decision. There was always at least someone who disagreed, and in many cases it was 3-2. And we each had different reasons. You know, someone was very big on like the cost, equity, access, or the quality. And so to me, like, look, this is 5 people who know healthcare pretty well and know these systems pretty well, and we couldn't even agree. So there's just no clear winner, actually.
But the one thing that stands out is that among all major developed nations, it's pretty clear that the United States comes in dead last.
On the other hand, I think everyone, especially experts, should be skeptical that they know the answer. Because what works in one country or one setting doesn't necessarily work in another.
So, you know,
Very
there are aspects of the Australian system I like. There are aspects of the English system I like. But I don't think that there's a system we could just bring over here and install, like a new fridge.
So maybe the better question is, what would the best system for the U.S. look like?
And what would that look like?
So a good healthcare system, or a good, let's just call it a healthcare system. A good healthcare system has, I think, to me, several attributes. One is,
how does it affect our health as a country?
How long is it that people are living?
Isn't that the big one?
What is the infant mortality rate? What is the rate of certain types of diseases, and how well are they doing in prevention?
And the second question I'd want to know the answer to is, were the benefits of the treatment greater than the cost of the treatment?
A bad healthcare system could have overspending on care that's of really questionable health benefit at the same time that it has underspending on healthcare that's of vital importance to people. So when people say, do we spend too much on healthcare? We spend way too much on some things and way too little on others.
True.
So a good system would fix both problems.
And the third dimension for a healthcare system is, how well does it reflect our values as a society?
And by values, I mean, what are the rich willing to do for the poor? What are the healthy willing to do for the sick? The answer to that doesn't come from economics. It's an answer that we all have within us. But that answer profoundly affects how you answer questions about what's good and bad about healthcare.
And I would hope that going forward, as we think about the learnings from other countries, we can take a hard look at what it is that we have and whether they align with our core principles that we otherwise hold so dear.
So my goal is have a health system that does the most it can to improve our health, that protects people from financial ruin, and that conforms to our values as a society.
So yeah, that would be the right thing to do in principle. The next question should be like, can we get there from here? And I just don't see it.
Wow, that's kind of dark.
Depressing. I mean, the likelihood of it really truly changing in the U.S., I mean, what would it take?
There's good and bad about our system, right?
Right.
Like the biggest one again is the price, the cost that we spend in general, and the cost it costs to get health insurance and whatnot, and pay for the deductibles and whatnot. But you know, like, we cover the poor with Medicaid, we cover the elderly with Medicare. Both of those are generally free or extremely low cost. We're talking like $1 or $2 to go to the doctor. And they cover everything, including dental usually, at least for the Medicaid section. So like, it's the middle class that generally have the biggest issue when it comes to affording health care in the U.S. And it's the issue is like the bandages that'll cost $50 for a Band-Aid. You know, they overcharge on everything. A lot of that comes because they expect you to negotiate, but no one ever does. No one for some reason in this country knows they can negotiate with the hospitals.
But it's exhausting, honestly.
It is.
Who wants to have to go to the hospital and then after the fact worry about having to negotiate your bill to be able to afford it?
Yeah, it's kind of ridiculous.
What we've seen over time is that the costs of healthcare have gone up, but outcomes have also improved. So if we take some measure, and the measure that I like to use is life expectancy at age 40. And then I look on the other axis at the cost of healthcare per person. And what you find is, if you look back to 1976,
all of these countries, the US, Germany, Canada, look similar in terms of what share of GDP goes to healthcare.
That's
and they
interesting.
are all living, people are living about 35 years after age 40. Okay.
Fast forward 20 years,
See where it goes.
the US is spending a lot more of
Oh,
its GDP
man, look
on
at that.
healthcare. And its
Holy.
life expectancy increases have
Wow.
not kept up with the life expectancy increases in other countries.
So the U.S. becomes increasingly an
What
outlier,
happened?
both in terms of outcomes, that is life expectancy, and in terms of spending.
Now, you can put the two on the same graph, but that doesn't mean that they're related in any way. I think we're simplifying the other healthcare system to the point of getting it totally wrong. But a lot of it depends on who you're talking to, right? I think there's a view that some Americans have that in other systems care is terrible. You know, there's very long waiting lines and waiting lists, that the latest medical technologies are routinely not available. I think for a lot of other Americans, there's this view that other countries have just figured it out. And what we should be doing in the United States is
Copying, yeah.
what they've already figured out. And I think both those views are not right at all.
So I think people mix up this term called socialized medicine with what I would call universal health care.
One is the insurance part, that is who runs the insurance, and you can have socialized insurance where the government is running the insurance, or private insurance or private companies, or both. And then second, there's the providers of medical care, who could be either government-run employees or private employees.
There are some methods that one could classify as being socialized medicine, meaning that the government is a single payer, the government operates all the healthcare, and people belong to a single government system.
So Britain has socialized medicine because the hospitals are government institutions and the physicians and nurses are government employees.
And France has yet a different kind of a system, also not government owned. And Switzerland, Netherlands, Germany, these are places that have universal health insurance, but they have active and important private health insurance companies that administer it. So very different structures of these systems.
Did you catch that?
Yeah.
I've never even thought about the fact that some countries would have what's known as universal health care, but they were privately owned.
Yeah, how does that work?
I can't even picture how that works. I mean, I guess maybe it's something about the government regulates them and says you can't charge above this amount for different services, but they technically don't own. The government doesn't own and completely control
they don't
it.
Control them, yeah.
Wow, huh? That's interesting.
I know. I've never really looked into deeply other countries' healthcare.
Yeah, me either.
I've been too busy drowning here.
The UK is the only healthcare system outside of the US that we've really looked into at least a little bit, and even that we're very
barely
limited in our
scratching
knowledge.
the surface, yeah.
But I'm curious, guys, if you know about these different healthcare systems, these different universal healthcare systems, which do you think is better? The one where the government completely controls everything in a universal healthcare system, or the one where there's a lot of privatization within a universal healthcare system?
Right.
The thing that they share in common is that they're universal.
So I think, coming full circle, my great worry with healthcare reform in America is that it has collapsed to the level of kind of fighting and arguing about these slogans. And the slogans have nothing real behind them.
These slogans have become so politically charged and tied to a particular candidate or a particular viewpoint that has become completely partisan and will shut down constructive debate.
And if you go back to what I was talking about, how do you evaluate a good healthcare system? You don't evaluate it by the share of government in the system. You evaluate it by whether patients
what the outcome
care
is
that they get and whether the care that patients get is worth it. I think that other countries have great hospitals, cover a lot of medical treatments, have fantastic doctors, and at the same time, they have not figured out a bunch of things that we have not figured out. So if you are the kind of person who's going without health insurance in the United States,
I hate to say it, but I think they are better off in many other countries than here in the US.
For sure.
But for a lot of diseases, for a lot of people, regardless of income, this is probably the country where you would like to get your health care.
Really?
Wow. Well, that was interesting to say the least.
It was interesting, but also, again, just barely scratching the surface of the ins and outs of. But I mean, it's very nuanced for each country, so.
Yeah. I'll say this, like, I've never had, like, what I would call horrible service in the U.S. Generally speaking, it's been good. I can go see a doctor very quickly and things like that. The problem is the cost, for me at least. I'm someone that I don't have an issue with the way, the quality of care and stuff. It is the fact that we have this horrible system that allows almost extortion with the pricing.
That's what I was going to say. I think the main problem in the U.S. is healthcare as a business. It's to make money, and as much money as possible. Did
you hear all those universal health care systems in other countries that were privatized? Those are private businesses, but somehow
they're regulated to
that. Ding. Yeah. Yes, that's the key here. I think there's good regulation. And then there's over-regulation. Mm-hmm. Good regulation would be saying that you shouldn't be able to charge $50 for a Band-Aid. You know what I mean? That is needed. Mm-hmm. That is the problem that we allow. For example,
there's no cap on anything. You can just do what you want.
Like someone goes to a hospital and they need this prescription drug. They need this drug while they're in the hospital. Mm-hmm. And then they look on the itemized bill and they're being charged, I don't know, $50 for a tablet of whatever this is, that it in most countries it would be like $1. You know what I mean? Like that's the issue we have here is that they're extorting everybody with their pricing. And I don't know why that is. I don't know what the answer is, because for some reason we can never get a hold of, what that is and change it. It's just really unfortunate because the middle class are screaming about this, and unfortunately, it's actually, I think it's on average going up like 30% this coming year, or in 2026. Yeah. It's insane.
But yeah, I think it would be interesting maybe for you guys. Let us know in the comments if you want us to do a more in-depth video on what it's like to have to choose a healthcare plan.
Yeah, like we'll take you, if you want to see that, we could take you on and let you see what our options are and see what the pricing is and things like that, and see kind of what you get for that.
Yeah.
And I think it's hard to wrap your heads around just how crazy expensive it is. Not everybody, but a lot of people just can't fathom it, I think. At least it's expensive to us. I think it's expensive, considering what you get for it.
Well, it's more like what you don't get
for it. Yeah, depending on depending on what plan you get, like how expensive you're willing to go. Yeah, you can get good health insurance if you're willing to pay for it. Yeah.
Crazy.
Yeah. But anyways, guys, I think that's it for today. Let us know in the comments if you've experienced different healthcare systems. What healthcare system do you feel has it the most right? I think like they were saying,
there's
generally
no
speaking,
one perfect.
No, I don't think there is. I think in some countries you're going to have just amazing quality of care, but it's going to be a little too pricey. In other countries, you're going to have it's going to be free to at the point of use, but you might have to wait a little bit longer. Or there's going to be pros and cons to every country, but there's going to be some countries that get it more right than others. And I think that in general, from what I see from an outsider, it seems like you guys, a lot of you in Europe area, the UK, France, from what I understand.
Yeah, France was one of the top.
It seems like you guys figured out something.
Yeah.
That seems to work for you, at least from what we can see on this side of the pond.
I wonder how much that is to do with a smaller population. You know what I mean? Like.
Yeah. Well, here's the thing. I think there's probably something to it. I think it might be harder to implement at the scale of the population we have here. But nonetheless, you just have more people paying in to that same system. Yeah. I think the real issue is that, again, they're able to extort us. But guys, enough rambling from us. Thank you so much for stopping by. Please click that like button. Feel free to drop your comments or suggestions about this video or others. And don't forget to subscribe to continue to follow us on our journey. Until next time, peace.
Bye.